Good morning, YouTubers. This is Dr. Tall Paul Simon, psychiatrist. I just wanted to talk to you a little bit about depression, what it is, and what to do about it. So, there's a lot of talk about depression. There is a lot more awareness of it nowadays, which is great, but there's a lot more of it, I think, because social isolation, COVID didn't help. Our disconnected lives, we're staying at home a lot more, working from home a lot more, and we have a lot more social isolation. So it's important to recognize what it is and how it's addressed. It's one of the worst, most burdensome conditions known to humans. It's, I think, about the second or third most burdensome disease, according to the World Health Organization, as far as impairing work and burden on the economy in the world. So it's a serious issue all across the world, but also, more importantly, in our own personal lives. When you're in depression, you feel alone, and there's no hope. At least it feels that way. And that's the trick, is that it feels that way, but it's not that way. So depression actually distorts your perception of reality. When you're in depression, you don't want to do things that used to be pleasurable aren't pleasurable anymore. People that enjoyed being around, you don't really want to be around. You may be tired or just frantically trying to hold on to all the things that you've gained, and it's just not working so good anymore. People can cry or not cry, or their appetite can change. They may be gaining weight or losing weight. There's a change, and it's not a good change. You don't have to feel sad in depression. That's one of the common misconceptions. It can just be a loss of pleasure, loss of good things in your life. So people can also have concentration issues, their performance and just their ability to get things done. They just get bogged down and their motivation is gone. People don't always notice around you when you're depressed. And depression is impairing. It's got to cross a line somewhere where it's really impacting your life. It's not just a mood. People can say, "Oh, I'm depressed," and that's a mood. That's more like a sadness or, getting the blues or something like that. Full-on clinical depression is weeks or more, at least weeks, of just feeling down or just not enjoying things, and with a smattering of other things like, sleeping more, eating more or less, and focus issues, energy stuff. It's just a whole bunch of things that is really holding someone back. So it's got to be bad enough that it's really impacting your life. Okay. Now, one important thing to go back to the perception of depression is that when you're in depression, you can't see out of it very well. It's like being in a pit. Okay, and if you're in a pit and it's above your eyes, you can't see out. You can't see the horizon. You can't see the sky. You can't see the hope that's there. Another good way to look at depression is if you've ever seen the Wizard of Oz, the movie. Dorothy and her friends go to the Emerald City, and they are told, well, before you go to the Emerald City, be prepared. It's so beautiful, amazing, it's overwhelming. And in the movie, they just walk in and it's all colorful and wow, it's terrific. This is great, this is beautiful. People dancing and animals and all this kind of stuff. But in the book, it's a lot different. So in the book, Dorothy and her friends, they go to the Emerald City and they're not allowed right in. They have to step into a little room, and they're told, the Emerald City is so bright that if you look at it, you'll go blind. So you have to wear these goggles. And so the guide there puts these goggles on their heads and locks them on their heads with a key. And so when they walk out of the Emerald City, they're just amazed. Wow, everything's emerald. It's amazing. It's beautiful. But the thing is, in the book, the city is not emerald. It's the glasses that are emerald, okay? So when you're wearing the emerald glasses, everything looks beautiful and amazing. Well, depression's the opposite, okay? Depression is kind of like wearing poop-colored glasses, okay? Everything looks like poop, okay? For lack of a better term. So you got these poop-colored glasses, and just everything looks like poop. You look in the mirror, it looks like crap. You look at the world, you look at your family, you look at your job, you look at everything, and it just looks like crap. So depression's like that, and sometimes you can't get the depression glasses off. You know, they're locked on there. And so first thing, you know, is recognizing that you have the glasses on there, that you are depressed, you know, and finding the help to get those depression goggles off, okay? Medications can help. Therapy and counseling is always recommended, really. And we'll talk about that in a separate video, okay? So please subscribe to this channel, Dr. Tall Psychiatry. I'd like to keep doing these videos, and your subscribing really helps me to do that and reach more people to kind of help get to them and try to help out, okay? So you take care, okay?